Millions of Americans rely on Medicare every single day, and among them, more than half have chosen Medicare Advantage. It's the option that's marketed as all-in-one coverage, with extra benefits, fewer hassles, and often a $0 premium. But how much of that is true, and how much is marketing? In this video, we're going to break down the real myths and realities behind Medicare Advantage so that you can make a truly informed decision, especially with the big 2026 Medicare reset coming. Let's start by understanding the landscape. Over the past few years, Medicare Advantage enrollment has exploded. Around 69 million people are on Medicare, and roughly 37 million of them are on Advantage plans. The appeal is obvious. These plans promise hospital, medical, and prescription coverage all under one umbrella, often throwing in extras like dental, vision, hearing aids, gym memberships, transportation, and even over-the-counter allowances. For many, it sounds like a no-brainer. But here's where the reality check comes in: these benefits aren't free. Someone is paying for them, and it's usually you in one way or another. One of the biggest myths about Medicare Advantage is that it's completely free. You've probably seen commercials shouting, $0 premium, but what they don't explain clearly is that while the plan may not charge a monthly premium, you still have to pay your Part B premium to the government. That's about $174.70 per month in 2025, and likely rising in 2026. So even though your Advantage plan premium might say $0, you're still paying a base cost every month to stay covered under Medicare. And beyond that, Advantage plans have out-of-pocket limits, co-pays, co-insurance, and restrictions that can add up quickly if your health changes. Another common myth is that Medicare Advantage gives you more freedom. The truth is often the opposite. Most Advantage plans are either HMOs or PPOs, and both come with provider networks. In an HMO, you usually must see doctors and hospitals within your plan's network, or your care won't be covered at all. PPOs give you some flexibility to go out of network, but you'll pay more for it. Traditional Medicare, on the other hand, lets you see any doctor or hospital in the country that accepts Medicare. That's over 90% of providers nationwide. With Advantage, that freedom shrinks. And this isn't just a minor inconvenience. Imagine you travel out of state to visit family and have an unexpected medical issue. Under Original Medicare, you're covered anywhere in the US. Under many Advantage plans, you might face out-of-network costs, or no coverage at all. This is one of those details that most people don't realize until they're in the middle of a crisis. Let's bust another big myth, that Medicare Advantage covers everything. Many people think because it includes extra perks like dental or vision, it must be a complete package. The reality is, those extra benefits are often limited or capped. For example, your dental coverage might only cover cleanings and exams, not crowns or implants. Vision coverage might include one eye exam a year and a small allowance for glasses, but not specialized lenses or surgery. And hearing aid coverage can vary drastically. These benefits sound great in marketing, but they're not equivalent to full standalone coverage. Now, let's talk about costs, because here's where many people get caught off guard. Original Medicare has no out-of-pocket maximum, which is why some people pair it with a Medigap, or supplement, plan to cap their costs. Medicare Advantage does have a maximum out-of-pocket limit, which sounds good in theory, but those limits can be as high as $8,000 or even $10,000 a year, depending on your plan. So if you have a serious illness or surgery, you could end up paying thousands out of pocket before your plan kicks in fully. If you're finding this information helpful, make sure to subscribe to our channel. We share important Medicare updates and guides every week. Now, here's something most people don't realize: Advantage plans are not government-run. They're private insurance companies contracting with Medicare to manage your benefits. The government pays these insurers a fixed amount per person per year, often around $12,000. From that, the insurer has to cover your medical care, prescriptions, and all those extra benefits. So what happens when the costs of care rise faster than what they're getting paid? They cut somewhere, and that's where you feel it. This is why, heading into 2026, many insurance companies are exiting certain markets or cutting Advantage plans entirely. United Health Group, the largest in the country, has already announced it's pulling back plans serving more than 600,000 members, mostly PPO plans, which tend to cost insurers more. Other major companies are expected to follow. That means many people currently on Advantage plans will lose their coverage and have to choose a new plan by the end of 2025. Here's the hard reality: when an insurance company eliminates your Advantage plan, they don't automatically move you to a new one. There's no crosswalk. You have to actively enroll in a new plan, or you'll default to original Medicare without drug coverage. That means no Advantage plan, no supplement, and no Part D, which can leave you exposed to huge medical and prescription costs starting January 1st. Another myth is that Medicare Advantage and Medigap are basically the same thing. They're not. Medigap, or Medicare Supplement, works alongside original Medicare to fill in the gaps, like deductibles and co-insurance. It doesn't have networks, and it's accepted nationwide by any provider that takes Medicare. Medicare Advantage replaces original Medicare altogether. It bundles everything under one private plan, which can be convenient, but it comes with restrictions, network rules, and often changing benefits each year. And those changes are important. Every year, Medicare Advantage plans can adjust their premiums, co-pays, deductibles, and benefits. What you signed up for last year might not be what you have next year. That's why reviewing your annual Notice of Change, or ANOC, is critical each fall. It lists exactly what's changing, and in 2026, there will be more changes than usual as companies reset their offerings after a financially tough few years. Let's also talk about prior authorizations, one of the most frustrating realities of Medicare Advantage. With original Medicare, your doctor decides what care you need, and Medicare generally pays for it if it's medically necessary. Under Advantage, the insurance company often has to approve your care first. That means even if your doctor orders an MRI or surgery, you could be forced to wait days or weeks while the insurer reviews it. According to the U.S. Department of Health and Human Services, millions of these authorizations are denied every year, sometimes incorrectly. This creates unnecessary delays and, in some cases, worsens patient outcomes. Now, to be fair, Advantage plans do have their upsides. For people on a tight budget, that low or $0 premium can make coverage accessible. Some plans do include valuable extras like dental or hearing coverage that would otherwise be expensive to buy separately. And the out-of-pocket limit can protect you from catastrophic costs, something original Medicare lacks without a supplement. So yes, Medicare Advantage works well for many people, especially those who are healthy and have predictable medical needs. But it's not one size fits all, and that's where so many myths mislead seniors. One myth that's become common lately is that Medicare Advantage is replacing original Medicare. That's not true. Original Medicare still exists and isn't going anywhere. What's happening is that more people are being marketed into Advantage plans because private insurers make a profit from managing them. But that doesn't mean Advantage is automatically better or worse. It just means the system is evolving toward privatization, and you need to be aware of how that affects your choices. Another misconception is that once you join Medicare Advantage, you can switch back to original Medicare anytime. Technically, you can, but there's a catch. If you want to go back and add a Medigap supplement, you might have to pass medical underwriting. That means answering health questions, and if you have certain conditions, you can be denied coverage. The only exception is if your Advantage plan is being terminated or you're in your initial enrollment period. In those cases, you have what's called guaranteed issue rights. Otherwise, it's not automatic, and many people get stuck. This is where planning ahead is critical. If you're currently healthy and thinking about switching to Advantage, remember that your health could change later. And when it does, you might not be able to switch back to a supplement plan. So, think long-term, not just about the next year's premium. Now, here's something that doesn't get talked about enough: how Medicare Advantage plans make money. These insurers get a flat payment per enrollee from the government. But they can earn bonuses if they meet certain quality ratings, those star ratings you see on plan brochures. Plans with higher ratings get paid more by Medicare, which incentivizes companies to maintain or boost their scores. The issue is that those scores don't always reflect actual patient care quality. Some ratings are based more on administrative factors than real outcomes. So, when you see a plan with 5 stars, it doesn't automatically mean it's the best for your needs, it just means it meets Medicare's metrics in specific areas. There's also the reality of cost shifting. As healthcare costs rise across the board, insurance companies have to find ways to stay profitable. That could mean raising co-pays, increasing deductibles, adding referral requirements, or cutting benefits. And all of these changes show up subtly, one small tweak each year that adds up over time. Heading into 2026, the Inflation Reduction Act's drug pricing changes will further squeeze insurance company margins. That means we're likely to see even more premium adjustments, reduced flexibility in PPO plans, and tighter controls over care. So, if you're on a Medicare Advantage plan or considering one, now is the time to pay close attention to the notices and the fine print. Let's clear up one more myth, that insurance agents and brokers can automatically move you to a better plan each year. They can help, but only if you reach out or authorize changes. And here's something most people don't know: when you respond to a call from a national call center or a TV commercial, your existing agent might be removed from your account as your broker of record. That means they can no longer assist you with that plan. Many people don't realize this until they lose their trusted advisor's help. So, if you have an agent you trust, make sure you go through them directly each year rather than responding to random calls or ads. Medicare Advantage isn't a scam, it's just a complex system where the pros and cons depend entirely on your individual situation. If you're healthy, on a fixed income, and mostly use in-network care, it can be a great deal. But if you have chronic conditions, travel often, or value unrestricted access to providers, Original Medicare with a supplement might serve you better in the long run. The key takeaway here is that $0 premium doesn't mean zero cost. All-in-one coverage doesn't mean all care is included. And extra benefits don't always translate into real financial savings. The marketing makes it sound simple, but the reality is far more nuanced. As 2026 approaches, expect to see more plan consolidations, higher scrutiny on provider networks, and shifting drug coverage responsibilities. This period, what many are calling the Medicare reset, is your opportunity to reassess whether your current coverage truly fits your needs. Don't assume that what worked last year will still work next year. Review your options carefully and talk to a professional if you're unsure. If you found this topic helpful, we've covered other related Medicare updates you'll see at the end of this video. Watch those next for deeper insights.